So let's talk about what you do for sleep apnea.
Well, I'll tell you what. This is a relatively new aspect of dentistry, and the problem with it is it's a problem that a lot of people have, but very few people know they have it.
Okay.
Okay, so that's difficult. So and most people just, well, I'm just tired. I'm working too hard. Well, in fact, there could be something else. What happens when you're sleeping is you actually stop breathing. Okay, and the trick is, how do you keep breathing? Because literally, it's like someone's got a pillow over your head, and and then they put the pillow on and take it off and put it on, like several times a night, like several times an hour in many cases. Okay, so once you find out that's the situation, or how you find out about it, because it is potentially dangerous, it can kill you. Okay, so what you want to do is you want to find a medical sleep doctor. Okay, and what they'll do is they'll get you to do a study, and they'll give you a CPAP. The CPAP is the gold standard of this. However, CPAPs, if you know anybody that has one,
I know one person. They hate it. They don't use it.
I had one patient. This really got me. It hit me hard. He says, John, he said, I hate my CPAP. He said, but I hate it every single night because that's how much better I feel when I get a good night's sleep. Okay,
so what are you able to do as a dentist? That's the part I don't get.
That's the whole thing, and we're the only people that can actually take care of it because that's what we do: dental prosthesis and appliances. So what we do is what happens is if you sleep on your back, your jaw relaxes and your jaw drops back and it closes off your airway.
Okay.
Okay. Now, if you remember from CPR 101, the first thing you do, step 1 in CPR, is tilt the head back to open the airway, and that's what we have an appliance now that will bring your jaw forward, and it opens your airway. So it's almost like CPR.
So it makes sense. I mean, these are people that during the day they breathe fine.
Oh,
it's
yeah.
only when they lay down. So it's obviously some sort of a mouth-jaw issue.
It is a mouth-jaw issue.
So you open it up. Interesting.
And what happens is, what's nice about it is a lot of times it eliminates the snoring. Okay? It's not for snoring, but that happens because snoring is just one step towards sleep apnea. In most cases, it's not been officially agreed on that.
Okay.
But the point is, what happens is the snoring slows down, okay, and stops. The person gets a good night's sleep. The spouse gets a good night's sleep because when somebody's snoring, there's at least 2 people are having the problem. One's annoyed and one's potentially critical, okay? And so we usually hear from the wife. And one thing I would say is there's a very characteristic. I'd say this to any spouse. If your spouse you see them where it looks like they stop breathing, and they give an audible gasp, it's like that. It's not just normal snore. They've been being smothered, quite frankly. Get them to see a doc. Get them to get a CPAP, and if the CPAP isn't something that works for them, get to see a dentist who's familiar with this. Not every dentist.
So you see appointments for this?
Sure. And that's something that
you work with other dentists, and you guys collaborate. Are there stories of people that were on CPAP and this took
Oh yeah,
clients?
it's one of the more exciting things about dentistry because we're going from saving teeth to saving lives, and that's something that we really weren't doing. We were improving lives, but we're actually keeping people alive, which is pretty exciting.
How soon on that consult can you predictably tell somebody, I think this is going to work for you?
Actually, at the consultation, what I do is I take a look at things. I see how wide their airway is, how thick their neck is, and by the way, muscular people, not just fat people, bodybuilders have the same problem because muscle takes up the space as well. But yeah, we can take a few measurements of where their jaw is, how far their jaw comes out, and we have a pretty good idea that we could make a big improvement with that. So you can get into that without getting too into it, so to speak.